Hi everyone, welcome back to Forward Therapy. I have another new CHT prep video for you this month with 10 free practice questions to help you get ready for the CHT exam. How this works, we'll go through all 10 questions. Go ahead and take as much time as you need, pause the video as needed to pick your answer, and then we'll go back through each question and I'll give a brief rationale with the correct answer. All right, without further ado, let's get into this video. Question 1. A patient presents to your clinic with the finger locking, in which you observe that extensor tendon is translating to the ulnar side of the MCP joint when the patient attempts to make a fist and straighten the digits. Which of the following structures is likely injured? A. Extensor retinaculum. B. Triangular ligament. C. Sagittal bands. D. Terminal tendon. Question 2. You are treating a patient with a necrotic, draining wound. Which of the following would be an appropriate dressing choice to promote wound healing? A. Alginate. B. Hydrocolloid. C. Impregnated gauze. D. Semipermeable foam. Question 3. Flaps such as crossfinger or thenar flaps, in which the surgeon will detach skin and sensate tissue from a donor site and reattach it to the recipient site, are known as A. Free tissue transfer. B. Split thickness skin graft. C. Local flaps. D. Pedicle flaps. Question 4. In the first 2 weeks of rehabilitation following a subacromial decompression, which of the following would not be part of your treatment plan? A. Pendulum exercise. B. Use of a sling between exercises. C. Full end range of motion of active and passive range of motion. Or D. Gradual passive range of motion as tolerated. Question 5. A radial head fracture with dislocation of the distal radio-ulnar joint is A. Galeazzi fracture. B. Monteggia fracture. C. Essex-Lopresti fracture. D. Terrible triad fracture. Question 6. If a patient has a positive teardrop sign when attempting to create an O shape by touching the thumb and index fingertips, what structure is likely affected? A. Anterior interosseous nerve. B. Dorsal sensory radial nerve. C. Median nerve at the carpal tunnel. D. Ulnar nerve at Guillen's canal. Question 7. A patient had a Fuchs injury 6 weeks ago that resulted in a distal radius fracture, which was treated non-operatively with a cast. The patient presents to the clinic to begin range of motion exercises once the cast is removed. The patient reports they noticed a sudden inability to extend the thumb. This potential complication after wrist fracture is likely due to A. Carpal instability. B. Extensor pollicis longus rupture. C. Radiocarpal arthritis. D. Malunion resulting in DRUJ disruption. Question 8. Which of the following treatment goals would not be appropriate with a patient 4-week status post-Derrick procedure? A. Use of a wrist orthosis between exercise sessions and at night. B. Scar massage and management. C. Wrist range of motion exercises. D. Using TheraPutty for building power grip. Question 9. Which of the following procedures would not likely be used to treat a patient with Kienbach's disease? A. Scaphocapitate arthrodesis. B. Scaphotrapeziotrapezoid arthrodesis. C. Proximal row carpectomy. D. Suave Kapanji. Question 10. A patient reports wrist pain that is worse with heavy use of the extremity, reduced wrist range of motion, and clunking that occurs intermittently after a Fuchs injury with negative x-rays. Upon palpation, you note they are tender to palpation distal to Lister's tubercle with a flexed wrist. Which of the following provocative tests would likely be appropriate in your assessment? A. Watson shift test. B. Cozen's test. C. Piano key test. D. Finkelstein's test. Okay, everyone, congratulations. You made it through all 10 questions of this month's CHT prep video. Go ahead and pause this video if you need more time. Go back through, make sure that you pick an answer for each question, and let's go back through all of the 10 questions with their most appropriate answer or most correct answer and a rationale for that as well. Question 1, correct answer here is C, the sagittal bands. This is sort of a classic sign of sagittal band rupture, where that extensor tendon normally will be held central over the metacarpal head, and most commonly with sagittal band rupture, it's going to translate or sublux to the ulnar side of the MCP joint. Watch out, because these can often get mistaken as trigger finger, either by patients or sometimes even the referral will say trigger finger because the finger is locking. Question 2. The correct answer here is C, impregnated gauze. The other options, alginate, hydrocolloid, and semi-permeable foam, are really good for granular draining wounds. Necrotic is best to use a impregnated gauze, or that's a good option. Question 3, correct answer here is D, pedicle flaps. Local flaps are going to come from adjacent tissues, so like the Moberg advancement and the VY advancement. Split thickness skin graft is a graft versus a flap, and then a free tissue transfer is used for larger defects, so like the free groin flap, the scapular flap, the lateral arm flap, etc. Question 4, correct answer is C, full end range of motion of active and passive. In the first 2 weeks post-op, you would want to start with active assistive range of motion and then progressing to full active range of motion somewhere between 2 to 6 weeks, dependent on the surgeon preference, dependent on the patient. But generally those first 2 weeks, you're probably not going to be doing full end range of motion or end range of motion. Question 5, correct answer is C, Essex Lopresti. The Galeazzi is a forearm fracture of the distal radius near the wrist and a dislocation or subluxation of the DRUJ. The Montagia fracture is a fracture of the ulna with dislocation of the radial head at the elbow joint. And terrible triad is going to be elbow dislocation, radial head or neck fracture, and coronoid fracture. Question 6, the correct answer here is A, the anterior interosseous nerve. That positive teardrop sign is sort of a classic clinical sign of AIN palsy or weakness. Question 7, correct answer here is B, extensor pollicis longus rupture. Fun fact, actually, when I was a brand new baby hand therapist, one of my patients with a distal radius fracture came in after doing, really well for several weeks, and they actually couldn't extend their thumb. And at that time I was still sort of brand new and still learning, and I knew something was wrong, but I didn't know how that the EPL rupture is actually it's not common, but it does happen with distal radius fractures, so it's always good to look out for. Question 8, correct answer here is D. Gentle strengthening can generally begin 4 to 6 weeks post-op if approved by the surgeon, but you should avoid power gripping until week 8 to 12. Question 9, correct answer is D, Suave Kapanji, which is a wrist salvage procedure for DRUJ arthritis. And question 10, correct answer here is A, Watson shift test, because based on the description, there is some sensitivity around the scaphoid or the scapholunate area. Cosen's is an indicated test for lateral epicondylosis. Piano key would be good for if you suspect a Druge instability, and Finkelstein's is for Decravane's tenosynovitis. Okay, amazing job, everyone. I hope that video was helpful. Congratulations on making it to the end of these 10 free practice questions. For those of you studying for the CHT coming up in the next year, amazing job. Just know that I'm super proud of you. It's a really hard journey and it takes so much work and effort. And so hopefully this video can help you out in some way or other. Let me know if there are other ways that I can help you as you prepare for this amazing accomplishment and journey of studying. And I hope to see you all in the next video. Okay, thank you so much for watching.